Hello everyone. Today we are going to continue the video that we have started yesterday about taking the medical history of a patient. So actually we have stopped at the past medical history yesterday, right? So now we are going to continue with family history. So let us dive into the topic. So actually the family history is supposed to be number 4, right? In the section. Taking family history. Family history. So actually, in the family history, you are going to ask the patient his position in the family. For example, let's say he is second, maybe he is he's firstborn or lastborn. So you have to ask him actually. So then, position in the family, position in the family of the patient. Then type of family: is it monogamous, polygamous? Type of the family: is this polygamous family? Is this monogamous family? So you have to ask him. Then history of similar illness in the family. For example, if he comes to you with, for example, chest pain, then you will ask him, in his family, is there anyone that is suffering from chest pain? If there is, so he has to tell you that person is in, because you may find for example, the some family having two children with sickle cell, because it is genetic, right? It's running in the family. You can find in the family two children, or even the parent are having a problem. For example, one of the parent is having asthma, so there is likely their children, one of their children or two, may also have also asthma. So you have to ask him whether if there is similar symptom or similar illness in the family of that patient. Then you will ask him about some diseases. For example, like, is there anyone having diabetes mellitus in your family? Is there anyone that is having sickle cell disease, that is sickle? Is there anyone that is having hypertension in your family? Because is there anyone that is having asthma? Because all these diseases can be actually linked with genetic predisposition. So that is it. Then you have to ask him about history of atopy. History of atopy. Of atopy. When we say atopy, means allergic reaction. Is there anyone in your family having allergic reaction to something? So and so on and so forth. That is it. Then we are going to now look at the number 5, which is called the social history. The social history. So when we say social history, like, it is a kind of actually where you are going to be asking about uh, marital status, even though you have asked him in the biodata, but now you still need to know, for example, then that's marital. But if you have already know in the biodata, then I think no need to know it now. But we are going to ask him number of children. If he is having the children, then you are going to ask him education level. Has he completed high school? Education level. Has he completed high school, or now he is in high school, or he has a degree? So because this patient, you are going to educate him on how to take his drugs, or maybe on how to prevent the occurrences of his illness, or to prevent the severity of his illness. So you have to know the education level of that person to know whether he can understand some kind of guidelines that you will actually put on him. So then you have to ask him whether he is having cigarette smoking. Cigarette smoking. If he said yes, I am having cigarette smoking, then you have to ask him how long is he taking the cigarettes. If he said maybe, for example, 20 years, then you have to ask him about, you have to quantify, that is, you have to know how many pack has he taken in this 20 years of smoking, for example. And then you have to know whether he's taking 1 pack a day, 2 pack a day, so and so on and so forth. So you have to know actually. So you have to also ask him about alcohol. If he said yes, I'm taking alcohol, you have to know which type of alcohol is he taking, right? So that is it. And then the quantity of alcohol that is taken, and also for how long he is taking the alcohol. Because someone who is taking alcohol, for example, 5 years, 10 years, he's at high risk of getting liver problem, right? For long. Or if it is, for example, someone can say, I started taking the alcohol, for example, let's say 1 week ago. But if he's taking it excessively, he may end up having pancreatitis, right? Binge drinking, right? So that is it. So that is the importance of asking this alcohol actually. So that is it. Then now we are going to see the review of history. That is review of system. I mean, because after you have asked him all this, then you are going to ask him the review of system. That is what we call the review of systems. Review of systems. Review of systems. So you have to start from central nervous system. You have to be asking him on why are you going to ask him the symptoms that are related to other systems. For example, in the CNS, you have to ask him headache. You have to ask him about, are you having headache? If he says no or yes, then document it. Loss of consciousness, because it's a symptom of loss of consciousness, because it's a symptom of central nervous system. Is he having a kind of blue vision, that is blurred vision, that is problem with his sight? Then you have to ask him. Then, for example, in CVS, cardiovascular system, you have to ask him about dyspnea. Are you having dyspnea? Are you having cough? Right? Are you having palpitation? Palpitation, awareness of heartbeat of a person. Someone will come to you and said, I am aware of my when my heart is beating, I am having a kind of awareness when it is beating. I'm actually experiencing the beating of the heart. That is the palpitation, actually awareness of one's heartbeat. Because you cannot aware you are not aware unless if you touch your chest with your hand. You cannot know whether your heart is beating, right? You can only detect the beating of your heart when you touch your chest. But if you don't touch your chest, you cannot feel the beating of your heart. So, but in palpitation, you can experience that. So that is associated with anxiety disorders or kind of fibrillation or kind of arrhythmias. You can have this palpitation actually. And then you will ask him about paroxysmal nocturnal dyspnea. You will ask him about orthopnea. So that is it. Then orthopnea, because this associated this dyspnea, cough, paroxysmal nocturnal dyspnea, orthopnea are associated with heart failure. So you have to ask him about also GIT symptoms, like have you ever vomited recently, vomiting, nausea, so and so on and so forth, like abdominal pain, diarrhea. So you have to ask him all this actually. Then urinary system, urinary system. You have to ask him like painful urine. Are you having problem with painful urine? That is dysuria, difficulty urine. Are you having a kind of urgency? So this is here. There is R. So are you having a kind of frequency of urine? Because someone will tell you that within 30 minutes I used to go to the toilet, for example, 5 times. So this is frequency, right? So that is it. So all these symptoms you are asking him, because some patient will have the symptoms, but they will not tell you why. Because, for example, if they come to you with headache, they will assume that nothing relate headache, for example, with this frequency in urine. So they will not tell you that. They may be thinking that, so what connect headache and then difficulty in urine? Then I will not tell him. Or sometimes the patient will tell you the symptom which actually affect him most, which disturb him most. Because, for example, if this frequency of urine that he is having didn't make him to worry, but he is only worrying more about the headache, then he will not tell you about this frequency of urine unless if you ask him. That is the essence of asking this review of systems. In each system, then ask the symptoms that are related to that particular system actually. So that is it. Then at long last, I have to give you the formula for taking the history of presenting complaint for pen, which is more easier than using the 5C. As I have already said earlier, if you are dealing with symptom which is not pain, like for example dyspnea, like for example dysuria, not dysuria is pain, like for example let's say nausea, vomiting, diarrhea, all these they are not pain, right? So you will use that 5C. That 5C is more suitable than for that. And even the pen, you can use the 5C, but this the formula I'm going to give is actually mildly recognized formula for taking the history of presenting complaint if it is pain. For example, headache, for example, abdominal pain, for example, chest pain, for example, hand pain, any pain. That is it. So with the formula for taking the history of presenting complaint, which if it is pain, it is known as Socrates. Socrates. Then if the site, if he said abdominal pain, then let him show you exactly where is paining him. If it is in the right side or if it is in the left side, then let him show you. Onset, you see in the history of in the type C, we also have you have to ask him about symptom. That is the pet in the first C. So you have to ask him about onset and duration. When did the pen start? How does it start? What are you doing? The pen start. That is the onset. Then duration, for how long? So that is it. In the pipe C, in the first C of the pipe C, you are actually asking this. Then character of the pen. Some pen are stabbing pen, as if someone is stabbing you with a knife. Some pen are sharp pen, because in kind of the sharp pen, for example, if it is in the chest, you are maybe suspecting like pericarditis. If it is stabbing pen, maybe you may be suspecting like a kind of heart problem. If it is, for example, even pericarditis can come with the stabbing pen. For example, if it is squeezing in character, squeezing pen, so that maybe you will be thinking about maybe angina, so something like that. Then does it radiate? That is radiation, because some pen you will experience them in your, for example, abdomen, then they will radiate to the shoulder. That is, for example, in the case of cholecystitis. If you say, for example, if it's angina, if the pen started in the chest, it will radiate to the upper arm. If it will radiate to the jaw. So that is it. Then associated symptom. Some pain are associated with some another symptoms. For example, someone with heart problem can have chest pain and then dyspnea at the associated symptom, right? So you have to ask him whether if there is dyspnea, depending on the disease that you are thinking. If you are thinking that this person is having his chest pain due to heart problem, then you will be asking him, you will be asking the symptoms of heart problem, right? Like for example, fatigue, dyspnea, and so on and so forth. Then timing, in which time mostly this pain actually occur. For example, someone with ulcer, peptic ulcer actually, mostly the pain is at night. Mostly not. For example, someone with a kind of especially if it is duodenal ulcer, mostly the pain is at night actually. So that is it. Then this is exacerbation and relieving factors. So what makes this pain to be worse? For example, if someone who is having his chest pain due to, for example, heart problem, he will tell you that the moment I started exercising, or the moment I started doing home activities, then I will start experiencing this chest pain. So this means this chest pain is aggravated, or it is making it to become worse when I exercise, right? And then relieving factors, he will tell you that maybe the only thing I used to do to relieve this pain is to actually to have a rest. If I rest, then this chest pain will go. So that is it. Then severity actually, you have to determine the severity, you have to use a kind of grading. You will ask the patient that, for example, if you can grade this pen over 10, what will you give the rating? For example, you say maybe it is 2 over 10, the pen is 2 over 10. Someone who is very good in exaggeration will tell you that maybe this pen is 10 over 10, because this is showing you the severity of the pen. But this is not the most appropriate way in determining. the severity. Actually, the most appropriate way to determine the severity is you have to ask him whether this symptom is preventing him from doing his normal life. If, for example, the patient tell you that I'm doing my job, I'm going to my office every day, this problem of mine or this pain didn't inhibit me from going to work, so this means the pain is not problematic. But if he says now I'm having uh, I spent more than 2 weeks without going to work, so this means this symptom of his is very severe. So this is the most accurate way of determining the severity actually. So this is the end of the lecture. So thank you very much.